It didn't give me that little option. Yeah. All right, everybody. Thanks for being here today. Welcome to this week's edition of the Katy Returns to Work Task Force webinar. I am Rick Ellis. I am with the Katy Area Chamber of Commerce, and I'll be your host today. We have a very unique presentation for you today, focusing on how the COVID-19 pandemic has affected small business and how businesses are returning to work. Today, we'll be talking with Laura Hamilton and Michelle Shelton from Christ Clinic, Trang Cherie with Polished Nail Studio, and Dr. Teddy Tekatal with Zion Urgent Care Clinic. So let me introduce our players and then we'll get started. Christ Clinic's goal is to bridge the gap between health inequities and lasting wellness for the uninsured and the underinsured in our community. The clinic sets a high standard for accessible, reliable, and high-quality medical services to the financially challenged residents of all faiths, race, and creeds. Laura Hamilton is a registered nurse, and she is the executive director of Christ Clinic. Laura joined the Christ Clinic team as a clinical manager back in 2012 and then transitioned to the executive director in 2017. As executive director, Laura ensures Christ Clinic is highly adaptive to the needs of the community, the safety net healthcare system, and to individuals that are sick with no other options. Her leadership has empowered Christ Clinic to become the fastest growing community clinic in the greater Houston area. Michelle Shelton is the Director of Mission Assets at Christ Clinic and oversees human resources and volunteers. Michelle has been a member of the Christ Clinic team for 5 years and is very enthusiastic in her efforts to make sure those who work for Christ Clinic can maintain a sense of balance between giving aid and not burning out. Trang Cherie is a unique nail salon manager. She is committed to providing excellent customer service and knows her clients very well. She is a thoughtful person who makes everyone feel welcome. Her special gift is in ensuring Polished Nails clients and staff receive the best treatment possible. She is truly a self-made woman who earns her business every day by sheer hard work, determination, and grit. And Dr. Teddy Tekatal is the medical director of Zion Urgent Care Clinic, which is located over by Katy Mills Mall here in Katy. He has studied infectious disease and public health and has practiced medicine both internationally and domestically. Zion Urgent Care opened in June of 2019 and is Katy's newest family urgent care center of choice and offers short wait times, compassionate and affordable care, and full service primary care. So there we go. We are recording this so it can be on our Facebook page and our website and YouTube pages as well. And without any ado, we are going to go ahead and get started. If you all can see that first screen there, that is Polished Nail Studio and a photo of Christ Clinic. And the way we're going to do this is we've got 10 topics and 10 slides, and we're just going to go through the 10 questions that we have and let our presenters, there's all the questions. We're going to go through them one by one. So if we can go to the next slide, we will start with how the impact of COVID-19 on your business. And Cherie, let's get started with you. I'm sorry, Trang. Let's get started with you and let you tell us how COVID-19 affected your business.
Hi, this is Trang Cherie, for the manager of Polished Nail. Nice to meet you all. So have you been know the COVID-19 been affected all the small business, including Polished Nail Studio? We experience we only able to see 30% of our regular clients coming back with us. This create the problem when our employees, we used to have 20 people that work in full-time 6 days a week. But because the decrease of the client volume, we go down to only 4 people working full-time, and the rest of the employees have to work in part-time. Today, we try the best to share the work so everybody have a little income, but that is been said that we've been cut off a lot of source for the income that we receive. Our hour also been affected. We used to have open from 9 to 7, but now we cut it up the hour from 10 to 6. Um, Also, for the day that we operation, we used to work 7 days a week, but now some week that we're really slow, we have to cut down to 1 or 2 days. We have to close the salon, um, and it's been really difficult. And we try the best to stay where we at, but definitely the change of it is a little bit more than what we thought that we experienced.
Trang,
And
I have a quick question, Trang,
Yes.
on the closing down your hours by an hour later in the morning and an hour earlier in the evening. Is that so you can spend time cleaning?
Yes. Yes.
Okay, that's what I thought.
Yes,
Okay.
that is, we have to focus on, that's one, and plus that instead of getting a long hour and we don't see our client, back to back, we decided we're going to cut off the hour to suit whatever the people to schedule right now.
Okay, I understand. Laura, how about the effect on Christ Clinic?
so the effects of Christ Clinic have been really widespread. I did want to back up for just a second and just kind of, I guess, tell everyone why I have asked Dr. Tekatel and Michelle to be on this call for us. So, as we're kind of looking at this as case studies between Polished Nails and Christ Clinic, and just kind of looking at how are small businesses implementing all of the different things that we've been talking about over the previous webinars, I felt like it was important for us to have some an authoritative voice when it comes to HR and infection control. While I am a nurse, my skill set over more recent years has been more in operations. So as we get into some of the slides and we're talking about risk exposure and some of the cleaning and things like that, things that we have done to help with infection control, then we may have some questions for Dr. Teddy. And then when we get into some of the employee kind of questions, then we may defer to Michelle and she may help us answer some of those. So the effects for Christ Clinic have been widespread. Just initially our patient volume has come down. It's about 70 to 90% virtual now. So we were seeing around 80 patients a day in the clinic. And about 30% of those are walk-in people that don't have appointments, and they could be new or established patients. And so now we're closer to 10, sometimes 15 in person, and now we aren't taking walk-ins at all. So you have to have a screening over the phone, and then we have 2 different triage points that people have to go through before they can actually even make it into our building. Because we have to go to so much virtual care, that's not really optimal in some ways for our patient base, especially when it comes to collections. So we ask our patients to contribute to the cost of their care. We ask for $25 for a new visit and $15 for an established visit. But in patient revenue, we usually bring in about $40,000 a month, and we're down to closer to 10,000. Some in like April and May, it was even at 5,000. So it was less than 75% down, or more than 75% down. So we have seen a big downfall in patient contribution, which is our only real revenue stream. And then we ask for money from foundations. So that's the other way we make money. We don't bill insurance. We ask for patient contributions, and then we ask for donations from individuals and foundations. So foundation giving has dropped off significantly. I think foundations are trying to decide what their role in this pandemic is going to be. And early on, we had there were different presentations and different associations that were telling us that funding for healthcare was going to be increased, and that there was going to be a lot of funding for healthcare considering it's a medical pandemic, but that is not at all what we have seen. And so as of right now, compared to budget, we're looking at about a $500,000 shortfall in revenue. And we have about a $2.4 million budget. So that's a really significant revenue shortfall for us. One of the bullets I didn't put on here, but Trang mentioned, and that was smart, is talking about hours of operation. So we put our employees on a shared work plan, which was through the TWC. I could let Michelle talk more about that because others might be interested in it, but it basically allowed us to take all of our hourly employees down to 60%. So they get the rest of their pay from the Texas Workforce Commission. And we just pay 60%, but that means they only work 60% of their hours. So our hourly team is managing our clinic operations from 9 to 3, Monday through Thursday. And then the rest of our salary team is what's keeping the clinic open the rest of the time. So we're still open Monday through Friday from 9 to 5, but the bulk of our patients are seen Monday through Thursday from 9 to 3. Michelle, do you want to add anything about the shared work plan?
Sure. Thanks, Laura. Yeah, we decided to put our hourly employees on the TWC shared work plan so that we could reduce their hours without completely reducing their pay. I will say if anyone is interested in doing that for their employees, the process was pretty easy. The shared work plan is good for up to 1 year. You can bring employees back on and back off. So you can increase their hours when needed and then decrease as needed. And the reporting is super easy. And so I would highly encourage anyone who is looking to reduce costs, but not, completely cut employees or reduce their pay completely to look further into that.
Yeah, I will add one more thing about that, and that's just as we get into further slides about capacity, the shared work plan has allowed a lot more flexibility in us bringing staff up and taking it back down based on patient needs. So, now as patient volume is starting to go up again, we're able to bring some employees in and take them off of the shared work plan, but leave others on the shared work plan. And then we can undo that if, numbers spike and we have to make more adjustments.
Okay. Can we go to the next slide and the next question? What changes have you made to your business due to COVID-19? Trang, you want to tell us about what's going on at the studio? Trang, you're on mute.
Okay, do you guys hear me?
There you go.
Okay, yes. So to adjust to COVID-19, our store were able to ask all the clients, also with the employees, all wear masks when they enter into our business. We send out the relief form for the customer when they book the appointment. So that's why they know all our COVID-19 rule. That is the one. Thank you. Yes. So they have the day and they have to commit that they don't have any sort of fever or sore breast, the symptom for the COVID-19 when they come into our salon. They need to make sure that they need to have they don't travel in the next 14 days to come into our salon. We just want to make sure everybody were safe from the COVID before, booking the appointment, and they know all the rules, what they need to do. We are cut off all the chatting in the salon. We don't have the menu or color choice in the salon anymore. By that, we do it online now. So the customer can able to see all the service, all the choices online before they come into the salon to reduce all the personal touch into the salon. We have the hand sanitation outside of the salon, include with the hand-free doorstep, so they don't have to touch onto the hand door when they come in. Temperature been checking, and washing the hand is required before and after the service. Every chair have 6 feet apart, and we also install some face shield divider between the technician and customer. So that's why we can have enough space when we provide the service. Since you guys know, when we provide nail service, it's a very close contact between the customer and the technician. And during the COVID-19, we also offer the home kit service for our clients that's still not ready to come back to our store. We have the custom package for at-home use, so they can just come by and they order online, pay online, and they can do the curbside before our salon for people who want still getting the service at home. Let me see. I have something, and another thing that I will have to make a big decision to decide that I have to increase the price for the salon, since when we get back, all the supply and everything go up like crazy. So we to able to prevent all the loss that we have to get and continue to move forward with the pandemic, we will increase the price for all the service, and I believe that is the really good move that we have to make, even though it's a little bit hard since all competition around is doesn't do anything change on the price. We also offer the special discount special for all the medical worker, the first funders, and they've been helping the community try to fight everything, and we really appreciate that. So we have that discount offer for all the medical staff.
That's great. That's wonderful.
Yes.
Trey, a question. Have you had to turn away anybody who didn't wear a mask? I mean, now everybody's pretty familiar with it, but have you had to turn customers away?
Can you say it again?
Sure. I didn't know if you had to turn customers away because they didn't have a mask.
Oh, we have masks at the salon to provide for a $1 cost.
Okay.
If the customer don't have the mask with them.
That's smart. That's great. All right, Laura, what about Christ Clinic?
So Christ Clinic, made the decision early on. We kind of sat down and as a team and talked about our priorities. This was, in early March, and we knew that our first priority was to keep our most vulnerable staff and volunteers safe, because some of our staff and volunteers have those same vulnerabilities that other individuals can have that would make them not fare well if they contracted COVID. And then our second priority was to keep our patients safe, because 65% of our patient population had those other risk factors that put them again at a higher mortality rate if they do contract COVID-19, or at least a higher chance of ending up on a ventilator. So with those two priorities in mind, we did a few key things. One of them was the 2 triage stations. So the purpose of the first triage station is to screen people for the COVID symptoms. And if anyone is positive, they're given a yellow sticker and asked to wait in their car. And they're given a piece of paper too with the direct number that they can call, and they're going to immediately get a telemedicine visit and get to speak to a provider to talk about those symptoms, so we can determine are those really COVID symptoms, or is that something else, and we should still see that patient. If we determine we should still see that patient, then they have a separate set of staff and separate exam rooms that they are seen in, and a separate entrance that they're escorted through, and don't touch anything, and they have to wear a mask. At the second triage, so if you make it through first triage because you're not symptomatic, you don't have any risk factors, and you get to our second triage point, that's where they know who is scheduled, and so they can see which of those patients have high vulnerabilities, and our patient population that is extremely vulnerable gets a different color, and they actually wait in their car. There's specific parking spots for them on the opposite side of the building, where they can come in a separate entrance, again with separate staff in a separate area of the building. And then our regular patients that are just green come in through a different area. We've eliminated our waiting room use. And so the purpose in separating the staff into the 3 categories, and the physical space into the 3 categories, and the patients into the 3 categories, was we knew our third goal was to maintain some level of operations because there's too many people in the community that rely on us. And so we couldn't risk having an exposure shut down our complete operations, like our whole team. You know, we're not that big. We've got 24 people on staff. And if you remember when this first started, there was a PPE shortage, and that even happened in the medical clinics. So now that we can get our hands on more PPE, we've been able to relax some of these. So we still do versions of them, but we can do them a lot faster. But without PPE, we had to be really strict about keeping our staff safe. So we also started using a lot of telemedicine, which I'm sure you have all been familiar with your providers. That was a different kind of transition for our patient population because a lot of the technology that's needed for telemedicine, they don't have. So that's been a struggle. We've had to do a lot more phone visits versus like Zoom, kind of virtual, like we can see each other right now. So there's been a learning curve there, but it's getting better. And then the other big thing was we actually set up a safe zone. So we had an area where our staff could work that patients did not go. And of course, staff were triaged in the morning too and checked. And everybody in there wears masks and gloves and stuff like that. But it allowed us to have a place that we could keep the risk for exposure really low. And we ran our curbside pharmacy pickup out of that suite. In addition to other things that we would do curbside, like some point of care lab tests, like if you're a diabetic, you need an A1C or we don't know what to do with your insulin. So we could do that finger stick at curbside in addition to, going back in, letting the provider make an adjustment to your insulin and then us delivering your insulin to you at the curbside. I think that's all.
All righty, going on to question number 3. What changes have you found most effective? Trang?
One change that I find it really effective is communicate with we were able to communicate with the client ahead of time about the rule, about if we make sure that they don't have any symptom for the COVID-19. So that's why it's made us be prepared. At the same time, the technician employees in our team feel much better because since we provide the service really close contact with the client, of course the member in the team or the technician getting really nervous because the chain is really high risk. So I think that is the most effective that we've been during the COVID-19. So we have a little bit more control of who get into our facility.
Okay. Okay, Laura?
So for us, our curbside pickup for our pharmacy has been unbelievably effective. It wouldn't surprise me if we keep some of that later. And then external triage, very similar to what Trang said about their form, it just allowed us to control the population entering our building. We actually had 4 entry points into our building and 4 entry points into our suites. So working with our property manager to allow us to block off those other points of entry so that we could properly screen the patients or the individuals that were coming into the building was crucial. So we're really grateful that they worked with us on that. And then the increased PPE usage during visits was, night and day for a medical facility. Not having all the masks that we needed and the types of masks that we needed in the beginning was crippling. So having plenty of N95 masks now and having face shields available to us and gowns has really been a saver for us to be able to still be able to see people in person and be protecting our staff.
All righty. So question number 4, what has been the most difficult about these changes that you've had to make?
The really change that I think is really difficult is require everyone to wear a mask because we have the You know how it's like when you come into the salon, you wanna breathe the herbal, you wanna relax in, and then you couldn't breathe when you had to wear the mask. But that is the thing that is really necessary when you come to more of all the small business to require. And some of our clients have some problem, medical problem, that they couldn't able to wear masks the whole time when we provide the service. So it's been very difficult to refill the service to wonderful clients, but it's been required from the government. We just try the best to follow the rule, what we need to do to keep our business open. So there's no other way. And I can't do anything about it. And I try to help people as much as I can. Special, they say, hey, I couldn't breathe when I wear the mask, but there's nothing I can do about it because this has been required not from the government, but for tested regulation. They require that too when the client come into the salon. So I find it's really difficult when we first open a couple weeks. The second thing is for the limit capacity, because the limit capacity, we cannot allow to have extra guests if they're not receiving the service. So it been say like if the mom tried to go get the service and have her 2, 3 kids here at the front desk, it used to be have no problem with us. We have the wide large reception area, and we even have the area for kids when they're waiting for their mom getting the service, or for the guest area. But though area is not available right now due to limit capacity. And that's also been said that uh, because the limit capacity, we cannot accept a lot of clients in one time. We have 21 chair, and we used to, on the weekend, we used to have them full chair that been used. But because the capacity and the sit fit apart, right now we only able to see not more than 10 customer at the time, because we had to spray everybody out for enough space for 6 feet apart. And I feel really bad when right now we have to sometimes have to refill the service for the customer that have extra guests, extra family. They're gonna have to have the family member either wait on the car, or we have to reschedule the appointment. And we always have that rule when we send out the relief form for let a customer know. But of course, sometimes they didn't pay attention, and when they arrive to the service, we have to tell them that we couldn't do it for them, couldn't have for that. And that is the thing that is really breaking our heart and our member team in the upfront for the front desk, that sometimes we have to make those kind of decisions to follow all the rules to keep everybody safe, include our customer and our staff that have family member on the high risk for the COVID. So we have to be very careful about who come into the salon and stuff. So I think that is a more thing that is become very difficult for us, that we have to make the choice.
Right, right. Laura, what about your difficulties?
So, I find it interesting that the two case studies that we have here are a charity medical clinic and a nail studio, and are the most difficult challenges for each of us are really similar, right? So
Yes.
ours is increased costs. It costs more to operate the way that we're operating. We need more PPE. We need more time from people per patient, and decreased capacity. We can no longer have a waiting room full of people, so we have 13 exam rooms, and most of the time we don't even have 13 people in the clinic at the same time. So, like I said before, on any given day, we would, run 80 people through our clinic, sometimes 100, and now we're looking at closer to 15. But we're still having to pay the same number of people almost to do that job.
Yes.
And then we have increased demand, right? So as our patients get sicker, at first we were like, okay, we can push this out 3 months. We'll just give people refills and we'll say, we'll see you in 3 months. But when you have the patient population that we have, and that's not completely unique to Christ Clinic, but we do have a very a vulnerable population for a number of reasons, but you can't continue just to put off hands-on medical care. So now that, we're further into this pandemic, we're kind of up against the tension of what's more dangerous, increased risk of exposure by bringing more people into our building at the same time, or letting their other medical conditions go longer without us laying hands on their patients. So, what we've tried to do is find out how to get more people in and continue to keep them just as safe. But it's been really challenging to do that without our costs skyrocketing. So it's been difficult.
All righty then, let's go to number 5. What exposure have you seen at your business or with customers?
Luckily, we didn't experience or aware of any case from either our customer or our staff. So, yep, I didn't have any people experience with that yet.
Good for you.
Yes, very lucky.
So at Christ Clinic, when we were doing COVID testing, we were seeing a 40% positive rate, and we were testing symptomatic and asymptomatic people. I was on a call with Harris County Public Health and several of the FQHCs, which are federally qualified health centers. So they're the community clinics in the Houston area. And their positive rates were sitting at closer to 25%. When they were testing symptomatic and asymptomatic, meaning people that are sick and people that are not sick. So the 40% number that we were seeing is pretty significant. And it was so significant that we felt like we couldn't continue to test because the labs kept increasing the minimum number of tests that we had to do each day. And with a rate of positive rate of 40%, that's a lot of patients to keep up with COVID. So we had to start sending our patients to the county systems, which is not ideal because the turnaround right now for test is anywhere from 10 to 14 days, which, is a really long time and clinically almost makes it irrelevant. But, and then we have seen positives in staff also. And I was going to take just a second to let Michelle kind of talk through what our policy is and how we handle it when we know we have an exposure in the clinic, because I think that's something that some of the businesses are still struggling with and have questions about.
Yes.
Yeah, so, with CDC guidelines and employment laws that are changing so frequently, it's really important that we've been staying on top of those and, making appropriate changes to this policy as they come in. But one of the things that we found in our policy that's been helpful when we have a positive employee for COVID is one, to protect that employee's information. So being a small staff, that can be challenging, right? Because, if employee A is out, there's only so many other employees. So I think that it sometimes can feel assumed, but really trying to make sure that we are protecting that so that we're not announcing, that an employee's absence is related to COVID. So really the way we've done this policy is that we ask for our employees to notify their supervisor as soon as possible. And then that supervisor is to notify HR within the same day. So then I, as the HR person, can reach out to that employee and have a series of questions that I ask them around symptoms and following the CDC guidelines. And then, that employee and I discuss what the plan looks like. And so we have 2 strategies that we use, a symptom-based strategy and a test-based strategy. So we have, different roles within our positions at the clinic. So for a symptom-based strategy for an employee that wouldn't have direct patient contact, that looks a little different. So we looked that employee would be fever-free without the help of fever reducers such as Advil and Tylenol or ibuprofen for at least 1 day or 24 hours. That they have one negative. So if they were to test positive, if they have them returning with one negative COVID test without any direct patient contact. So that's up to the supervisor's discretion what that looks like. So I definitely encourage supervisors that if there are tasks that those employees can be doing remotely from home, you know, to assign those duties. I know that every business has different client needs and business needs, so that may not always be feasible. And even in a medical clinic, that's obviously not feasible for all of our positions. But I would really encourage for business leaders to try to, you know, delegate tasks remotely if possible. Then with our test-based strategy, so that an employee that does have direct patient contacts can return to that position, we ask that they have 2 negative COVID tests before they can resume that direct patient contact position. And obviously in both cases, proper PPE still needs to be worn once the employee returns, and I as HR communicate with the supervisor, kind of act as like the mediator between the employee and the supervisor to update the supervisor on what the plan for that employee's return looks like. So sorry, I just totally lost my train of thought there. One thing that I think has been challenging with that is that there's been some studies that show that the positive results for COVID can remain in your nasal cavity for a while. I don't know, Laura, if you want to touch more on that, you might have more information, but I think that it's important to keep that in mind as well too, because someone potentially could keep testing positive for a long period of time, but no longer be contagious.
Yeah, so I'm sure Dr. Tekatel could speak more to that, but that I think, you know, that's why the CDC does give the 2 options, one being time-based and the other one being testing-based. And depending on the employee, we will use the time-based strategy, which doesn't necessarily require a negative test. It's just based on, you know, 10 days since symptoms started. All symptoms have started to improve. And then the 24 hours fever-free without fever reducer. And by the way, that just changed. Like in the past week, it was 72 hours. So if you've heard that number, you now know that that has changed to 24 hours. I don't know. So we have tried to move more away from the double negative test, especially because the test can be hard to obtain. I don't know if Dr. Tekatel's on and if he has any other guidance or thoughts about that, or if your opinion has changed with any of the new data that's come out since your webinar.
Yeah, I don't know.
Sorry, yeah, I'm still here. I'm still here. I don't think anything else changed. I'm glad actually this new recommendations came out, because before that it was still confusing. I know a lot of employers at this time are still requiring their staff to get 2 tests, even just 1 test for returning long after, you know, their illness, their symptom has improved. And we may have some way to go through before we, you know, get into some agreement or some understanding into that. It's still something new, so we are still learning, but definitely the PCR is definitely known to cause persistent positive. Up to 12 weeks is the maximum I've heard. I've seen myself patients who've tested positive more than a month, many patients, while they still don't have no symptoms. So that does not count anymore. I'm very glad about that. I've been writing letters to so many employers who asked for their employers to be tested, just saying, you know, this is where we are right now. They really don't need to be tested. Of course, there's a risk always in there. There are some people who have low immune system who may extend more than that 10 days. So if there's a discussion with the doctor, it's always good. If there's a discussion to see, these may be the people we may have to wait maybe 10 extra days to the 20 days, and have some form of doctor's letter together with it, describing that it's okay to take that risk, even if they had that positive test about, you know, 10 days ago, or even if they had a symptom about 10 days ago. They're clear right now. This is a continued discussion, but I'm glad we are at least having some concrete kind of guidelines to write based on the CDC right now. And 24 hours fever-free is definitely also the latest one.
Thank you, Dr. Teddy. That's helpful.
All right.
Thank you. Thanks. All righty. Moving on to the next question. Let's see. What is your risk plan if exposures happen, say, next week? What are you going to do?
Okay, so all the COVID-19, it was really interesting to listen to the doctor and at Chris Clinic sharing the experience. To be honest, all of it is very new to us. And we always, since I never have experience with either my client or my customer, my client or my technician or employees in here that experience with it. So all of this totally is something new, and it's a really good information that learning from you guys. For preventive, we also have like a risk plan before we get back to work. All the employees except also include me is already get the test, so they have the negative test when they go back to work with us. And every day they also sign in the paper for the relief form that they also don't have any symptom, include the temperature is not have any symptom, fever or anything, and we check the temperature on our employees as well to make sure when they enter the building to provide the service, they don't have any symptom. However, if we have experience with either customer or employees, we're thinking that we're gonna have to close the salon at least for 1 week, and we are gonna have to get the test again to make sure they have to bring up the negative. We cleaning the salon. We have the cleaning crew at the salon to do the disinfectant almost every day. But if that is the case, we're gonna need to have higher professional cleaning to clean up the salon, to spray it, just to make sure that everything clear from the COVID before we can open again. That is our plan.
Yeah, I see. I see. Laura, what about Christ Clinic?
So we have already had exposures, and you know, that's in the medical world. That's the environment we live in, right? Is exposures from one illness to another. So we've maximized our environmental barriers and you know, use of cleaning and PPE and separating our staff. So if we had an exposure next week, the general public wouldn't know it. We would be able to maintain operations. I mean, it would cut down on capacity some because we would lose some staff, but we would maintain operations.
Gotcha. Makes sense. All righty. How about number 7? How long do you think it'll take till you get back to where you were before the COVID crisis?
I would say with all the decrease about the client, and we couldn't take any more walk-in, like people don't walk in anymore. Like right now, they kind of like get you to with to get the service, they need to have the appointment. So we don't have that much walk-in, even though that we already fill up with more staff to accommodating more walk-in, but we don't have enough. So I'm thinking that it needs to have 1 to 2 years to get back where we're at right now with the condition.
Mm-hmm. Wow. Wow.
Yes.
Laura, what are you thinking?
So, you know, nonprofits are weird because we have this double bottom line, one being money and the other being service. And so as far as serving people and that bottom line, within 3 months of a vaccine, our operations will be ramped back up to what they were, and we'll be seeing, you know, a large number of 80 patients. Maybe I'm afraid that we're going to get slammed actually as soon as patients are able to come back in contact with us. I think one barrier to that will be getting our patient population vaccinated. I'm not sure what that's going to look like yet. However, on the other bottom line of revenue, I think it's going to take at least a year to make up the revenue that we shortfall that we're going to take for this year. And that's with God's grace, good luck, and hard work.
Is that, Laura, is that primarily the fundraising dollars you're talking about there?
Yep.
Yeah.
Fundraising, and then all the patient revenue that we didn't bring in for, you know, half the year.
Right, right. And on the vaccine, when you're talking 3 months after a vaccine, What is your thought on the time frame of when a vaccine? I mean, we keep hearing different things. I'm just curious to see what you think.
I have no idea. Honestly, I think anything that we're hearing out there, it's going to take a lot longer than that. I don't know, Dr. Tekatelo, Dr. Teddy, I don't know if you have any thoughts about how long on a vaccine. I think it's going to take a long time personally.
Yeah, the minimum at this time is still about close to a year. Again, I think it's not just finding the vaccine itself. There are some already almost ready, but acceptability, rolling it out, there's so many other factors that would definitely matter. And you've seen how, you know, the discussion has been going on about it. So that is another challenge all by itself. But I think in a way we will kind of learn to work with it, you know. That was my hope also during last week's presentation, is like, yes, there is an issue, and we want to talk about today itself, how do we maintain? I mean, how many businesses can't even survive another 3 months without really operating? It's a challenge already. So what can we do today? I do believe with, you know, maximal use of all the masks, just like Laura said, you know, we're getting exposed. We know it. We don't even need to think about it. We are all getting exposed every day. So to minimize is what we can do. It's not completely to stop it. It's not going to go away completely, at least at this time. So with maximum use of the mask, and the only area what I would say is, like, at least 1 week, if someone who has been exposed got sick, that is the employee, maybe I would have them stay at home. Otherwise, yes, we are getting exposed, symptomatic, asymptomatic, we're getting exposed every day. So we just kind of need to learn to work with it with maximum of every kind of prevention we can do. A lot of discipline, of course, but I think that's what we have to do right now. Vaccine, when it comes, we'll see with all its challenges how much it's going to benefit us. But that's not something we can put all hopes on right now.
Yeah. Okay, thanks, Dr. Teddy. Okay, next question, number 8. Let's see. Any permanent changes to your business or industry due to COVID-19? Trang?
Yes. The permanent, for sure, the permanent change that is gonna be still in the business is require more sanitary measure moving forward. We think we're gonna keep all the in divider between all the chair, still sanitize the hand, wash the hand before and after service, because after what we've been very experienced is, you know, even though if we find out we have the vaccine, there no COVID-19, but I think that it still have that extra step is always good. If even just regular like flu or something, then I think that's still really need to be added on into the industry to be more focused on that. And I think customer is also value the salon based on how the clean they are. They need to feel safe when they come to get in the service. What the doctor say about the vaccine, it's really interesting. In fact, the reason why I think in my business not gonna go back to where it were for 1 or 2 years is the same thing, because we don't know when we're gonna have the vaccine. So we still have to be disciplined and follow with the COVID guideline as much as we can until everything, you know, going away. I think getting everything cleaning, sanitizing is the most thing that is going to be the permanent change, and it needs to be focused on right now for my industry.
Okay. Okay. So Laura, telemedicine?
Yeah, I think that, you know, telemedicine and technology, I think sometimes in the charity clinic world and in medicine in general, we're resistant to some kind of change. And I think that from the funding side, telemedicine has been being pushed for a long time now. And I think this is forcing it to come along. And I think between payers and patients enjoying telemedicine, I don't think it's going anywhere. I think it's going to become much more a part of your relationship with your provider than it's ever been.
Yeah, I agree. I think it is going to go that way and stay that way.
Mhm.
Yeah. Okay. All right. Question 9. What small business questions are you wrestling with?
My question is, if they have any update to the BBB program to help the small business, and I also have a question more about since I don't have the experience with the people exploding with the COVID-19, I would love to know more about what I should do for the business if either my technician or my customer find out that they have positive with the COVID-19. But some of them I already have the answer since you guys been sharing about the experience, and it's really helpful for me since I didn't have that experience yet.
Okay.
Also, Trang,
Yes.
there's different alerts that you can sign up for from the CDC, and through I don't know which. You're in Fort Bend County, right?
Yes, I'm in Fort Bend County. Yes.
So I know Harris County has an alert system that you can sign up for, and a lot of times it's public policy stuff that's even relevant to Fort Bend. And then Fort Bend has their website, but the CDC I've found to be really helpful because they'll just email you when there's changes. So like, last week when the recommendation changed from 72 hours to 24 hours, I only knew
Yes.
that because I got that emailed to me.
Yes.
So I would definitely encourage business owners to go sign up on some of those forums so that they're constantly getting reliable information and up to date on changes. Because I mean, you're right. And Dr. Teddy said it's just constantly evolving. So we all have to be
Yes.
just constantly looking for new information and adapting.
Yes, that's required. Almost like if you ask me what's going on for next week, I definitely don't have the answer just because things changing every day, and
Right.
you just have to be catching up with all the new and all the update. We've been changing our update about our COVID guideline is almost every week, adding on, rebooting things that we can able to do just to adapt to the new, pandemic and stuff. And yeah, just try the best. And this is really good information. I'm gonna look into it.
Great.
I'd like to add to that too, that,
Yes.
for businesses that do have HR departments, more than likely, are up to date with the employment laws and members of SHRM, which is the Society of Human Resource Management. But for businesses that don't have a designated, HR department, I would say investing in that membership because it does have an app. And, if you pay for the membership, then anyone can join, and they have a lot of great resources on there for employers on what to do with employees so that you can keep up to date with those employment laws.
Yes.
Good. And then I think that the big question that we have is at Christ Clinic is how do we balance our capacity with the community need? I know y'all have all heard about the uninsured rates in Texas and the uninsured rates in our community, and the unemployment rates, and uninsured comes with unemployment. So, we were seeing a large patient population before. I mean, on our panel, we have about 12,000 patients that we see over a 1 to 2 year period. So that's a lot of people in the Katy area that are uninsured, and that doesn't account for the growth of Katy, which we were already having to try to keep up with that growth. But now not only are we growing in size in Katy, but more people that were wealthy are unemployed and uninsured. So I think Christ Clinic's got an uphill battle coming, and we're going to need as much community support as we can get.
Okay. Last question coming up. Upcoming business plans and goals for 2020 and 2021. How are you going to recover out of this and go forward? Trang? Oh, you're on mute, Trang.
Yeah, I keep had to adjust that. Yes. Polish now for the upcoming plan, we're gonna try the best to update with all the COVID-19 to keep everybody safe. We are value safety first, special for our wonderful staff the wonderful team and our wonderful customer. We really blessed with all the support from the community. All our loyal customer has been wonderful to us. We need the help, and luckily we have the listen from them. They've been support nonstop. So what we're doing is we're still gonna be maintaining our higher service to provide to our customer at the same time to keep everybody safe. We just try the best to be, work and stay in business as much as we can. Like I say, for the change that I make, I already increase the pricing for the service. So right now it's helped a little bit to keep it up with the higher rents, the higher supply that we had to experience with, and even sort of supply like a nail supply, other product, cleaning product as well. So we try the best to kind of like we cannot be cut it up supply, because that's how we can able to maintain the higher service profile that we always been giving to the customer. We don't try to lower on our supply to go forward about whatever that we try to do. That's why we decided that we're gonna be increase the price to suit whatever is happening right now. So my goal is just try the best to stay in the business and still keeping doing whatever we've been doing for the whole time. Customer coming to polish need to look good, and everybody had to feel good about it. We love to create that environment for everyone.
Sure. That's
Yes.
great. Laura?
So our plan and goal for now until year end is we have cut expenses significantly through the shared work plan, and we've even had to cut some positions. And then, we have decreased our operations with the hope of a break-even budget. So that's our goal for the year, is to still have a break-even budget with our decreased revenue.
Absolutely.
And then our other goal is just to find ways to continue to scale operations within our current budget. So, we got to, kind of like Dr. Teddy was saying earlier, we have to find ways to keep working more and more efficiently that still meet the goals of keeping people safe without costing us more money. So we're going to be required to operate more efficiently now than we've ever had to succeed. And Christ Clinic's not alone in that, right? I think that's going to apply to every business. So I think it's scary, but I think one of the great things about this country and a lot of the small business owners I know is that we're not afraid of a challenge, and we put in the work when we have to. And, I think that we're going to see a lot of businesses come out better than they were.
Yeah, that's great. Well, a couple of questions have come up, and that's the perfect one to segue to is budget. You mentioned budget. Nobody could have predicted this. There's absolutely no way. But did either of you have a little bit of reserve or a little rainy day fund to help you get through this at all, or are you just hurting financially?
Both. So we tried to maintain about 3 months worth of operating and reserves. And thankfully we had that, but we've definitely dipped into it.
Oh, sure.
We got the PPP loan, so that helped us not have to dip into that reserve as much and be able to utilize the PPP loan. But yeah, it's been really challenging. We're definitely feeling it financially.
Yeah, sure. Trang, any savings?
Oh, talking about that. So you guys know we have to close down the business in March 20, and we're not open back it on until May 11. That's when the first day that we open back. So we almost closed our door almost 2.5 months. Mm-hmm. So it's been very challenging when you still have to pay rent. Since you don't have any operation at the salon. So it's been very, very difficult for me to have to deal with it. We still try to work it on to get the help from the loan, but it's not really much. That it basically just help us to pay in the rent for the month that we close. But upcoming then we still have to try our best to really stay it on, but it's very challenging to talk about that. Yes, I totally experience and feel Laura.
Mm-hmm.
Well, another question came up, and you both just alluded to it, is the PPP. And the question was, did you all have either access for resources like loans or grants? And it sounds like both of you did PPP.
We did.
Yeah, we did.
Okay. Any other loans or grants? There were some other programs that were out there.
We didn't do any others at this point. We have not done any others. I've been looking at the Main Street Lending Program that's for nonprofits, but we haven't gotten very far with it yet.
Okay.
Yeah, so do I.
I know Fort Bend had a program going for a while. They might be something to look into.
Mm-hmm.
Yeah.
Okay. Well, this has been wonderful. I don't have any more questions. If you guys do amongst each other, let us know. Otherwise, we appreciate everything you all have done. This has been fantastic today. We got a lot of great insight, and I just wish you all the best going forward, and hopefully we can all persevere through this time, and just say thanks again and be well.
Thank you. It was great, and nice to meet you, Trang.
Yes, it's really great experience for me. Like I say, it's almost my first time to go online and do Zoom like that. So it's a really great experience for me, and a lot. Thank you so much. It's a lot of useful information that I learned from you guys that is gonna help my business grow even better. Thank you so much for inviting me as a guest.
Well, you did great. Yeah, you all did
guys.
great. Thank you. And this will be on our website and our YouTube and Facebook channels. So if anybody out there's got any questions, look at it and let us know if there's anything we can do for you all. But thanks again and be well.
Bye. Thank you.
Thank you.
Thank you.
Bye-bye.
Thank you guys. Thank you so much.
Bye-bye.
Thank you.